Almost the entire global population breathes air that exceeds WHO air quality limits. 4.2 million people die each year due to exposure to outdoor air pollution, in addition to 3.8 million whose deaths are linked to household smoke produced by dirty stoves and fuels. As per a new WHO data, a record number of over 6,000 cities in 117 countries are now monitoring air quality, compared to 1,100 cities in 91 countries a decade ago. But the people living in them are still breathing unhealthy levels of fine particulate matter and nitrogen dioxide. People in low and middle income countries are suffering the highest exposures.
We are very pleased to launch this report containing 6,000 cities monitoring now the quality of the air we are breathing. Maybe we can say that 6,000 is not enough. We have many cities around the world, but compared with what's happened in previous year, this is a very important increase on the willingness by cities to measure the quality of the air we are breathing. The bad news is that when we look at all of this data, still what the data is telling us that a big proportion, almost 100% of the global population is still breathing air that exceed the standards recommended by the World Health Organization.
Particulate matter, especially PM 2.5, is capable of penetrating deep into the lungs and entering the bloodstream, causing cardiovascular, cerebrovascular problems. PM 2.5 can impact other organs and can cause other diseases as well. NO2 is associated with respiratory diseases, particularly asthma, leading to respiratory symptoms, hospital admissions, and visits to emergency rooms. In the 117 countries monitoring air quality, the air in 17% of cities in high-income countries fall below the WHO's air quality guidelines for PM 2.5 or PM 10. In low and middle-income countries, air quality in less than 1% of the cities complies with WHO recommended threshold. Globally, low and middle-income countries still experience greater exposure to unhealthy levels of PM compared to global average. But NO2 patterns are different, showing less difference between the high and low and middle-income countries. About 4,000 cities or human settlements in 74 countries collect NO2 data at ground level. Aggregated, their measurements show that only 23% of people in these places breathe annual average concentrations of NO2 that meet levels in the recently updated version of WHO's air quality guidelines.
An interesting pattern that we have seen when we were comparing the regional differences between particulate matter and NO2 was that while for particulate matter we know that some regions are really impacted by air pollution like the one I just mentioned, and there has been also a huge difference between high-income countries versus low and middle-income countries for particulate matter. For NO2, the pattern is a little bit different in the sense that we see much less difference between low-middle-income countries and high-income countries, showing that this is still a huge problem even for high-income countries. And as it was mentioned at the beginning by my colleague, NO2 is a gas that is mainly coming from anthropogenic fuel combustion. This is a very good proxy indicator for urban air pollution, and this is linked often to transportation. So this is really a sign that countries still need to work on that and much more effort to reduce the emission of NO2.
The findings have prompted the World Health Organization to highlight the importance of curbing fossil fuel use and taking other tangible steps to reduce air pollution levels. A number of governments are taking steps to improve air quality, but WHO is calling for a rapid intensification of actions. The 2022 Air Quality Database aims to monitor the state of the world's air and feeds into progress tracking of the Sustainable Development Goals.